Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it.
Welcome to the start of a long talk about anemia, starting with conditions that lead to smaller than normal red blood cells. Microcytic anemia, in other words. Later, we'll move on to the anemias with normal-sized RBCs, and then, you guessed it, larger than normal RBCs. Get excited. The causes of microcytic anemia can be remembered with the acronym T.A.I.L.S, T.A.I.L.S, which stands for Thalassemia, anemia of chronic disease, iron deficiency, lead, and Sideroblastic anemia. In this scene, it's all about that first T, the Thalassemias, as we recount the tales of Micro Polo, known at Sketchy as Micro Polo. In the late 1200s, Italian merchant Marco Polo spent 24 years with his dad and uncle exploring and trading along the Silk Road of Asia, traveling as far as Japan. According to Marco, the trip included bandits, sandstorms, shipwrecks, and set a new bar for father-son bonding adventures. The whole 20-year trip culminated in a meeting with Kublai Khan, the Mongolian-born grandson of Genghis Khan, and the first Yuan emperor of China. Probably a good friend to have when you're a funny-looking Italian dude trading goods in occupied China. All right, before we jump into thalassemias, let's go over a few features of microcytic anemia in general. A low hemoglobin and hematocrit level means anemia, but to classify a microcytic anemia, you've got to look at mean corpuscular volume, or MCV, which reports the average size of RBCs in circulation. If the MCV is less than 80 femtoliters, now we're micro. Just look at how microcytic those tiny teacups are. Not only that, we've incorporated a less than 80 into the teapot. See? The thing you need to remember about microcytic anemias is that what we're usually dealing with here is a problem with production of enough hemoglobin. However, when the body senses that RBCs are low and tries to tell your bone marrow to increase production, your bone marrow just can't. So the reticulocyte count, which reports how many new immature red blood cells are getting pumped out of the marrow, will stay in the normal range, even though it should be elevated as the body attempts to make more red blood cells. The retic count stays under 3%, hence the little less than 3 symbol we've included on the tea bag. Or maybe that's a heart. Special friendship tea for Marco, maybe? We've chosen a tea bag because reticulocytes contain that characteristic net-like chromatin, as opposed to mature RBCs which have no nucleus, hence the purple net-like tea bag. Plus, a tea bag is like immature tea, you know? You gotta steep it first. Anyways, how about when you look at the RBCs directly, under the microscope? Well, hemoglobin normally makes up about 35% of the volume of a normal red blood cell. But we're having a problem with hemoglobin production, remember? So when hemoglobin is low, RBCs look smaller and paler than normal. We call these features microcytosis and hypochromasia, as depicted by the small and pale teacups. While you're looking at that blood smear, keep your eyes peeled for target cells as well. These small RBCs look like bullseyes, with a dark middle, a ring of pallor, and then a darker outermost edge, kind of like these saucers. They look this way because microcytic blood cells have way too much cell membrane compared to their small volume. As a result, the extra saggy cell membrane folds over on itself and forms dark rings where they're all scrunched up.